have a large people right now. They have to search housing units because they have a voucher. But the voucher cannot adjust it to these higher rents immediately. Please help. Thank you.
Thank you. Madam Clerk, is there anyone else?
That concludes the public comment portion for this meeting.
Thank you. Next is the approval of minutes from the February 14th meeting. Have my colleagues reviewed these minutes?
Make a motion to approve the minutes as presented.
Is there a second? Thank you, Mr. Gallagher. All in favor?
Aye.
Aye.
Any opposed? Thank you. The minutes are approved. Madam Clerk, the items referred to the committee today?
Yes, we're going to go out of order for this item. Item number R 2022-0059, a resolution authorizing a payment to the Mount Sinai Health Foundation fiscal agent in the amount of $800,000 for operational support for the Lead Safe Cleveland Coalition for the period February 1st, 2022 through December 31st, 2022.
Thank you. Welcome. Please identify yourself for the committee. You can take your mask off and explain to us the work that you are about to undertake.
Good morning, everyone. And I am Mitch Balk, and I'm president of the Mount Sinai Healthcare Foundation, or Health Foundation. We just changed our name. Shouldn't have. The foundation, together with United Way of Greater Cleveland, serves as the fiscal agent for our 500-member-strong public-private partnership known as the Lead Safe Cleveland Coalition. I'd like to recognize the coalition members from our backbone organizations who have joined us here today from Enterprise Community Partners, CHN Housing Partners, Environmental Health Watch, Cuyahoga County Government, the foundation sector, including Mount Sinai, and last but not least, today we also have Augie Napoli, president of United Way of Greater Cleveland. So please stand and be recognized if you would. Members of council, these leaders have gathered to show support and answer questions that you may have relative to our progress to date. While we come from different backgrounds, we share the same guiding belief. No child should ever be lead poisoned in Cleveland or Cuyahoga County. Lead poisoning is an issue that we all share a lot of concern about. It affects educational attainment, criminal justice, housing stability, workforce development. The cost of our community's lead poisoning problem is staggering to our children, our families, our shared future as a region. I want to begin by thanking members of council for embarking on this journey with us. Together back in 2018, members of county council or members of county government hopped on a bus bound for Rochester, New York, where together we went to school on how that city was able to reduce lead poisoning by 85% over 10 years. We left our families for 2 days to study a model that works by implementing a series of interim controls that reduces or eliminates lead exposure that causes irreversible brain damage in our youngest children. And while there are miles to go before we sleep, we in Cleveland know that we can accomplish near impossible feats when we come together as a public-private partnership. So today you will hear what we have been able to accomplish with your year one $800,000 support and what we've been able to leverage from both the private sector and from other levels of government. We do this and we ask for your support on behalf of Greater Cleveland's children today and for children of Cleveland yet unborn. So at this point, let me introduce to you Ayanna Blue Donald, Vice President and Ohio Market Leader for Enterprise Community Partners, the organization that leads our coalition, to discuss our project and our progress to date.
Thank you. Good morning, Chair, Committee. My name is Ayana Blue Donald. I am the Vice President, Market Leader for Enterprise Community Partners here in Ohio. Thank you so much, and just very, very thankful for the partnership and the opportunity that this funding allows us. Let me just give a little bit of an update and some information of how things have been going. Enterprise, we proudly convene and manage the Lead Safe Coalition that includes managing the Lead Safe Home Fund, a first of its kind to support property owners and families. When we say the Lead Safe Home Fund, we are referring to all of the resources, the programs, and services our city needs to make the lead safe certification feasible and to successfully prevent lead poisoning. The fund includes grants and loans for property owners, workforce development, community education, support for families, and more. Thank you, Cuyahoga Council, for your support and investment. When we launched this coalition back in 2019, we committed to work toward no child ever being lead poisoned. First, we supported the passage of the City of Cleveland's Lead Safe Certification Law. This groundbreaking law, few of its kind in this country, was the first critical step to ensuring property owners were creating lead-safe homes. But our coalition has said, essentially from day one, that there would be no mandate without resources. We cannot have people requiring them to make their properties lead safe without the resources there to assist. Our coalition has worked tirelessly to put all the resources in place to make that law feasible and successful. We've built the system to do it, and with your ongoing investment into the Lead Safe Home Fund, we are closer toward our Lead Safe Cleveland. The Lead Safe Home Fund has two interrelated functions. Number one, a spectrum of lead-safe home funds and grants for Cleveland property owners to make lead-safe repairs. And two, a lead-safe resource center to provide lead-safe certification navigation, workforce development, resident services, community education, and more. We are in the second year of the initial 5-year Lead Safe Home Fund budget, which runs until June 30th, 2022, meaning the second year of the Lead Safe Home Fund budget ends June 30th, 2022. This county award today will specifically support the Lead Safe Resource Center in year 3, which begins on July 1st, 2022. With the county's support, the Resource Center is set to achieve, at a minimum, the following in year 3. Host 50-plus community events, trainings, and classes. Make 1,500 unique resident, landlord, and community touchpoints in the specified or current zip code rollout areas that are specified by the City of Cleveland. Maintain bilingual Spanish-speaking staff or provide on-demand Spanish translator services. Handle target peak call volumes of 2,000 unique calls. Track all referrals based on type to the Resource Center. On a monthly basis, at least 15 to 25 property owners will work with the landlord-tenant engagement coordinator. Monitor the need for additional lead-safe workers and reevaluate lead-safe worker application process and evaluation criteria to make sure that there are enough lead-safe workers out there to do the work. Conduct at least 25 renovation, repair, and painting, better known as RRP classes. Conduct at least 12 clearance technician trainings. Conduct at least 20 hands-on vetting training, that's the RRP plus the clearance technician trainings together. Continually update the non-subsidized vetted list of lead-safe workers. We aim to have 20 RRP and 20 clearance technician lead-safe workers on the list by January 31st, 2023. Aid with up to 50 RRP firm certifications and 23 clearance technician reimbursements. This list, of course, is not comprehensive. It is not a final list of what the Lead Safe Resource Center plans to do as the outcomes and outputs expected for year 3, because keep in mind, we're still in the middle of year 2, and so we are at a place where we will negotiate with Environmental Health Watch, which leads our Lead Resource Center. Enterprise manages that in the quarter to come. Last but not least, I'm sure all of you have heard about the investment that has happened recently that we are very proud with. This investment that Cuyahoga County has given us allows us to leverage other investments, such as the unprecedented $50 million investment from Cleveland Clinic, the $17 million in ARPA funding from the City of Cleveland, and most recently, a $1 million federal earmark for the Lead Safe Home Fund. So to date, this allows us to say that we have funding from every level of government, which we are proud of, and thank you for being a part of that. These combined investments bring the Lead Safe Home Fund to approximately $115.3 million and ushers in an exciting and much-needed second phase of the coalition's work. We don't yet know the final set of programming and eligibility. For what we do know is these investments allow the coalition to increase our capacity to get the work done even faster, expand our programs to help more people, and address all impacts of lead poisoning. We indeed appreciate your partnership and hope to continue working closely together as we tackle this issue. We invite you and all community members that may be listening or watching to join our coalition. As always, every meeting is open to all. We also have resources available, so please, if you represent any part of Cleveland, we have resources to help people understand about complying with the Lead Safe certification law. We have our website, www.leadsafecle.org. Landlords can read about the 6 steps that are needed to get the Lead Safe certification. The website also includes a vetted list of Lead Safe Cleveland vetted contractors and clearance technicians, as well as information about financial assistance. The Lead Safe Resource Center hotline is 833-601-5323. Finally, to keep up to date about what is going on in the coalition, we do have regular reporting on these investments. We invite you and any constituents to join us in monitoring progress via the public-facing interactive Lead Safe Cleveland dashboard. And I will not read that long website, but if you're interested in that information, we can most absolutely provide it to you. Thank you again, and we will be happy to answer any questions you may have between myself and my colleagues that are here.
I have a question.
I'm sorry, I didn't have my mic on. Questions from my colleagues? I see Mr. Miller's hand waving. Okay.
I'll defer to the committee members and follow them.
First, Ms. Baker, and then Mr. Council President Jones.
So we heard some of this in Board of Control, and so I have a little bit of a heads up of your presentation today. I guess, you know, I struggle with this a bit because it's such an ongoing problem. It's not like this is a surprise or anything. This has been going on for a long time, and we know how detrimental it is to children. That's not a secret. So I guess I'm just asking, the example that was given, that 85% over 10 years was eliminated from another, I think, city that was visited. Why can't more immediate help be given? Why can't we, as we know that these homes, and I guess I have 3 questions here. What year homes are typically lead contained? What are the
Yes.
because there's an era of
Absolutely. Pre-1978, through the chairwoman to the councilwoman. So properties that were built before 1978, that is the year that lead paint was outlawed essentially or banned in residential properties. So any property that is built before 1978 is automatically presumed to be a lead hazard or to contain lead.
So given that it's before 1978, how many homes would you estimate that we have? And I'm not saying every single home and we have to go out to the outskirts, but clustered, I would think, of where we target the most vulnerable homes. How many of those homes do we need to overcome?
And through the chairwoman to the councilwoman, the number, I'm not sure. However, the percentages, I'm clear. Over 95% of the homes in the city of Cleveland are pre-1978. So that's not necessarily even, you know, let me clarify this, or just explain it in the way that I see it. If you think of over 95% of the properties in Cleveland were built before 1978. they likely have lead in it somewhere. But a lot of this is also about housing, because you kind of alluded to a question that
Yeah.
maybe I can kind of address, about housing stability and housing condition. So if you've been maintaining your homes and, any chipping paint, you're encapsulating it and it's not an issue, and you're doing the proper cleanings, and all of your friction surfaces are either painted, or perhaps you have new windows, et cetera. That's a different item. Perhaps you may not have a lead hazard present in your property. However, when we look at our rental property and the condition in our housing stock, right, that is what tends to be the issue. So when we think about the length of time that it's going to take, first and foremost, it's a big education component. That's why the resource center is very important, just to get people to understand. You're right, lead poisoning has been around for decades, right? So sometimes it is a little astonishing that we have not come together to try to tackle this issue, but there's been starts and stops throughout the years and decades to just say, oh, we're going to do this, and things kind of wane. But this is what is so unique, I feel, about the Lead Safe Coalition, is that it's just not one entity or branch. It's not just a health organization saying, oh, we're going to try to tackle this. This is not just the city saying, we're going to start up a new program, or the county, or philanthropic partners, et cetera. This is everyone coming to the table to bring all their resources to bear to say, we are going to address this issue all together. The county board of health, we're going to have people accountable. The city board of health, the federal government, everybody is pitching in. The state of Ohio, even the governor mentioned it in his state of the state last week regarding how important preventing lead poisoning is. So it's not a problem that happened overnight, nor is it a problem that we can fix overnight.
May I follow?
Yes.
So I hear you on all that, and I guess, like I said, what I struggle with is that we know today and tomorrow and next week and next month and next year, there's going to be children that are affected by this. And we know that it not only are they affected, but it is forever. They get a slow start right from the very beginning and have to constantly try and overcome what we all know their living environment is. So I guess we have $115 million right now. We know that 95% of the homes in Cleveland were built before 1978. We know that the rental houses are probably the highest compromised, because we have homeowners that take care of and try to do the best they can, and some landlords. But if we know where the most vulnerable are, why can't we put this project on steroids and really go after and make a difference in those clusters of homes that we know children are living in and are being hurt by it? I mean, 10 years? I mean, I don't want to go 10 years with this, and try and remediate. I want to go 2 years. I don't even want to go 2 years. I want to go 1 year. I want to get, of those 95%, I want to get at least 50 or 60% of those done next year. What does it take to really accelerate this program, or is it just not feasible? We just can't do it. But I guess the urgency are the children that are in these homes that we all know are compromised and have been compromised for years. And we are now coming to the table with some serious money, and I just want to see what can we do to make this happen sooner.
Through the chairwoman to the councilwoman. So I believe what you're referencing is that 10-year mark is namely Rochester. So Rochester, we used, as Mitch mentioned, we went on a bus trip to Rochester. Rochester, they have the national really like gold standard in eliminating lead in their housing stock and driving down the incidence of lead poisoning in their children. So it's a reiterative process. So if we think about what we're doing here, the City of Cleveland's lead certification process is a short time frame where every unit that is a rental property has to be certified by March 31st, 2023. Now, what does that mean? Every rental property should be made lead safe by 2023. Now, lead safe is not lead free, And that's also what I mean by a reiterative process, in the sense of they will have to be recertified again. So there are some landlords that will get it all right the first time. There are some landlords that may not even comply, which happens, what the city of Cleveland will have to do with enforcement to get people to fall in line and understand what they have to do. But it's a learning process as well. Do we think that after the first rotation of lead safe certifications, and hypothetically all landlords complying with the law, will that put the elevated blood lead level poisoning rates for child down to zero? No, but we aim to that it will greatly reduce the elevated blood lead levels, poisoning incidents. Also keeping in mind that we have researchers, Case Western Reserve University and Dr. Fisher leads our research group and evaluation to make sure that we are tracking these things to see how long it takes. The 10 years in Rochester was retrospective, in the sense that looking back, that's how long it took them. We aim to have it happen sooner, but also there are factors. There's a reason why the lead certification was staged and rolled in over a period of time, just making sure there's enough workers, right, out there in the community. We've kind of talked about that, and this is what this investment really funds, is workforce development and that training and that community engagement. No really system or process changes overnight. As much as I would love, everyone behind me would love that this could all happen overnight, it takes time. It takes time for even the city to process these things. It takes time for our workforce development partners to train and deliver these trainings. They're not just a 1-hour online training. They're hands-on to make sure people are doing things the right way and not recontaminating the property that they're clearing. So we for surely aim that a significant dent will be put into children being lead poisoned in the next couple of years as we go through this first stage or round of certification process. But then let's look at each time, at each cycle and each phase, we hope that the numbers will be greatly reduced. So no, Councilwoman, I don't think that it will take 10 years for us to see any movement. But we're also giving ourselves time with the reality that it's going to take people time to get on board with this, and to make their properties lead safe.
May I ask a point of clarification?
Sure.
Can you please explain the difference between lead safe and lead free?
Absolutely. Through the chairwoman to the councilman, it is a huge distinction. And so that's something that we aim every time we're in front of a crowd to make that distinction. Lead safe essentially is making remedial measures to make sure your property does not contain lead hazards. So making sure your property may be lead dust free, does not have chipping and peeling paint. Underlying issues, I really appreciate the public comment from earlier that talked about mold, et cetera, because also inherent in making properties lead safe is making a property healthy, right? Having healthy housing, and there are so many other inherent issues. And so with our recent investments that we have, et cetera, we are able to have grants that address some underlying conditions on top of making a property lead safe. A property that is lead free means that you have essentially taken a property down to the studs, you removed every piece of paint, anything that could be lead containing, and you've totally remodeled a property. Or there's also a procedure where you can essentially encapsulate lead, and I'm talking to this, but maybe Chantal, is there any other further explanation? If I'm doing a good job, don't come up. Okay, there are lead experts, but making sure that a property is lead-free, or you can encapsulate, that was the other word. You can encapsulate the lead as well, which is still different than just painting over it if you scrape and paint. But keeping in mind the two differences as far as lead-safe and lead-free is a cost. So a lot of people, comes the education to the community. When you hear lead safe or lead remediation, people jump to lead free, which is a vastly different cost than making a property lead safe.
I appreciate it. Thank you. Thank you, Chair.
Mr. Jones?
Councilwoman Baker asked the majority of all of my questions, but that was good information. One thing on the lead safe, lead free, is there cost? You said one is lead safe, I imagine, is a little less expensive than lead free. But did I understand correctly that if you're lead safe, it's an ongoing process of certification, and I assume an ongoing cost, potentially?
Through the chairwoman to the councilman, yes. So lead safe, the cost of maybe a couple $100, lead free, thousands upon thousands of dollars. So it's not just a little difference.
Lifeline is
Thank you,
coming,
Chantal.
yeah.
Come on up. There's a huge difference in the cost. Please introduce yourself as well.
Hi, I'm Chantal. I'm from Environmental Health Watch, and I'm our senior director there. So great questions. Definitely there is a cost difference. So with lead safety, that's just remediating lead hazards that are in a property, and it is more cost effective. Like Ayana mentioned, the bulk of our landlords are mom and pop landlords, and so it is more feasible to do the lead safe. So like she mentioned, with lead free, it's completely taking out all traces of any lead hazards in a property, which is high cost. She said going down to the studs, taking everything out and completely remodeling. That does last for 20 years, but with the every 2 years, if you think about that cost with the painting and maintaining a property after a landlord is trained for the work or they have a contractor, if you factor that over a year, it's maybe saving $20 a month. And so it makes it more feasible to every 2 years, if I put this aside and maintain my property after every rental unit, it's more affordable to me. And then when it gets to that certification, really I'm just paying for hopefully an environmental cleaning, which is optional, and then my examination to renew each year.
Did you say lead-free lasts for 20 years?
Correct.
Help me to understand. I imagine if it's free, I'm thinking it's free. What happens in potentially in 20 years that it's no longer lead-free? What's happening in the home?
So it's just any potential deterioration. So if we're encapsulating it, it's just over 20 years, we want to double check that that's still continuing to not be a hazard.
Lead-free.
Correct, right. Because there are ways to encapsulate it so where it can't get out. But as we know, over years, wear and tear, anything can happen.
Lead-free does not mean you're literally removing the lead completely. There's a encapsulating of the lead in the lead-free concept.
It's a portion of both. Most of it is removing it, but there are specific tactics, and I'm not a technician, but there are specific ways to encapsulate it. And so it's just to double check to make sure there's not that poisoning.
And if I may add respectfully, the numbers that we're quoting, the 2 years, the 20 years, these are all HUD standards and HUD guidelines. So the Lead Safe Coalition, nor did anyone behind me come up with these rules. These are industry standards regarding how long certain certifications last. And so also, as you mentioned, the lead free, if a property may very well have no speck of lead, but those are the rules, that it only lasts for 20 years. You have to just go back in, have a test to verify that that's still current, and then it will last for another 20 years.
I'd like to revisit Councilman Baker's question regarding the just the general numbers. If you have how do I say this? If in terms of the children, how many children have been impacted? If you know, how many children are? Do you have a sense of? Do you keep track of how many children have
Like
been
through a
negatively
year?
impacted by?
Every
Can you
year.
start recently, or can I just whatever you may know, how you like
Yes.
to characterize it?
Hundreds a year, if anybody knows that number. So keep in mind that there are different standards. So impacted, that's a number that we can probably say we do not know the answer, because there are children that don't get tested. There are children that, you slip under the radar, that very well that they may have been lead poisoned. Because also, let me take you back a step. Lead poisoning can only be identified for a very specific time frame, meaning when the lead is in your blood at a certain time, right? So if a child may be lead poisoned, let's just say at 1 year old, but maybe doesn't show symptoms until 5, well, that act of lead poisoning is not happening perhaps at that 5-year-old stage, right? So you very well may not be able to tell at that exact moment that a child has been lead poisoned, but very well may be impacted by lead poisoning. So the things that are trackable. So in the sense of if children have an elevated blood lead level, there are a couple different standards where one is an actionable level, where something has to be done, where there's a public health lead investigation that ODH, Ohio Department of Health, makes the whoever is here, the City of Cleveland's health department, actually does and conducts these investigations and holds it doesn't even have to be a homeowner, wherever this child is poisoned. It could be at the landlord tenant does this remediation. Anyway, there are different numbers. Short answer is there could be a whole host of children that are impacted, but only a couple hundred perhaps. And I say only because it's not only every single one matters a year.
Well, let's go to a more statistically clarifying point. in order for this to have become a crisis, we needed to have more than one child that was impacted. So what were the numbers that your coalition announced of the children who were impacted in any given year, or the cumulative number that you put in your media announcements?
Can respond. So with that, what we do know is of the children tested in the schools, 1 in 4 of those children has been lead
So how many
poisoning.
children are tested on in average annually?
I'm not sure of the exact number, but we do know it's lower than what it should be. So
Okay,
as
so
far,
it's still too vague to me. You're not telling me if 100 children were tested in 2019 and 25 of them had contamination. Somebody has to know a number for a specific year. Who knows that number? Can they come to the microphone? Mr.
Cancerat, the savior of the day. So this looks like, I'm trying to see by year. Oh, is this by rollout zone? Okay. Can I do the numbers in my mind, in my head? In 2019, I'm trying to add up numbers because it's not
Okay.
cumulative, it's by zip code.
So give
That's
us a
about
zip code
120,
then.
220. Okay. In rollout zone 1, which would not mean anything to you by zip code, there were 64 kids tested positive. So 45%. No, that's not, in the zip code, there were 1,600 children
That were tested?
that should have been tested, 727 children tested, and 64 tested positive, so about 8.8% of those children tested positive.
And in what year was that?
That was in 2019. And also keeping in mind, throughout the pandemic, the testing rates have gone down.
Right.
Okay. And so if I look at the highest incident, just eyeballing in a zip code, there was about 13% that tested positive in a specific
So
zip
was
code.
that, are these zip codes all in the city of Cleveland?
These are all in
Are some of them overlapping with suburban or inner ring suburbs like East Cleveland, Cleveland Heights, Shaker, Garfield, Maple?
Through the chairwoman, these are all in the city of Cleveland. This is the
Exclusively.
information that Dr. Fisher tracks on the dashboard that I mentioned.
Okay.
And so he has it by rollout zone. So the city of Cleveland has prescribed 8 rollout zones. And so he has tracked elevated blood level poisoning in children per those rollout zones.
Okay, and they're all tied to zip codes?
They are
So,
all tied to
For
zip codes.
example, 44113, which is an edge of downtown, is that one of those zip codes?
It should, through the chairwoman, yes, it will be. Every zip code in the city of Cleveland is encapsulated in the 8 rollout zones.
As an administrative point, Councilwoman Sunny Simon has joined the meeting. Thank you. So statistically, how many children have we, there was a 1 in 4 mention. Does that mean that in 2019, we saw 100 children and because there's a treatment for lead contamination. There were 40 children who received treatment. How many children are receiving or being prescribed treatment? Because you never know exactly whether they receive all of their treatment plans as outlined.
I can answer. Give me 1 second. I'm sorry. I was actually just adding up the numbers. So in 2019, there was 598 children that were poisoned in the city of Cleveland. So thank you. No, go ahead.
Please identify yourself.
Hi, I'm Dan Cohn. I'm with the Mount Sinai Health Foundation.
Thank you.
As far as treatment is concerned, I don't have that exact statistic, but I can get that back to you. So the number that we mentioned, there's a couple different numbers. Now, when I mentioned 598, these are the people that have the elevated blood levels that mandatorily have to go through treatment and or their homes being remediated. You would hope that all of them are being treated, but that would not be something that's tracked by the Department of Health and or the local health department that's handling. There's also a subset of even lower number of, no amount of lead poisoning is acceptable. This is the highest of the high, that the number that I gave you. There's also another number underneath that in the sense of a public health-led investigation is not mandatory, but those children also have to be monitored. And it keeps stepping down because, in essence, no amount of lead poisoning is safe. This is just a number that the Ohio Department of Health has said this is the critical number that has to be, you have to be treated if you hit this number and above.
So can I
Yeah,
just
please.
add, I just want to add a couple more things just in terms of the numbers, and certainly we can get back to you with more specific data. What we know is that between the years essentially of 2015 to 2017, so that 3-year time period, about over 10,000 children entered kindergarten in the city of Cleveland. Among them, 25% had already been exposed to lead hazards at a level that we know would affect them cognitively in most likely scenarios. So for, let's say, 3,500 or so children are entering kindergarten in the school district, 1/4 of them had been exposed to lead with an elevated blood lead level at or above 5 micrograms per deciliter of blood. That's the public health threshold for which we have data that indicates that children will have negative impacts throughout their lifetime. One of the challenges that Ayanna is referring to is that there are multiple thresholds. So we know actually the 5 micrograms per deciliter was just lowered by the CDC in the last few weeks. Now that lowest threshold is 3.5 micrograms per deciliter. We can get into that in a different conversation. But what Ayanna is referring to is the 10 micrograms per deciliter level is what requires a public health response. So those data are sent to the Ohio Department of Health. Then those data are sent back to the local designated authority or delegated authority, in this case, the Cleveland Department of Public Health, and that they are required to take public health action. And Chairwoman, there is not at this stage a treatment per se for an elevated blood lead level. Certainly there are recommendations and there are responses that medical providers can offer to families, which are frankly not all that different than what they would provide to families who have children that are experiencing learning disabilities or have early onset learning disabilities. Things like reading to your child, providing them extra language services. Unless the child has extremely high elevated blood lead levels, things that require chelation or hospitalization, that's really when we get into medical treatment. But when we're talking about the standard at 5 micrograms or 10 micrograms per deciliter, there really isn't a medical response. In fact, there really isn't a lot of data around what we can do at all for children who have already been exposed. The last thing that I just want to add here is that figure, that 25% figure, is actually very likely an undercount. We know that children are supposed to be tested at ages 12 months and 24 months for elevated blood lead levels. Only about 22% of children in the city of Cleveland are tested appropriately. And so we are likely missing, even though 25% is 4 times the national average, among the highest in the country, we are likely missing a significant number of children who are in fact exposed to lead but are just never discovered. It shows up later as things like ADHD or some other diagnosis or, violent behavior in adolescence that, just some troubled kid. But in many cases, those are children who have been exposed to lead in early childhood.
So thank you for that. So 25% or 2,500 Cleveland children were.
So of the 3,500, I'm giving you rough estimates. These are from 2017 data. So I'm sure we can work with Rob Fisher at the Mandel School to give more updated data. So I'm giving you ballpark figures. About 3,500 children entered kindergarten in 2017. 25% of them, roughly 25% of them, had an elevated blood lead level before they entered kindergarten.
So with that identified number, did that trigger an action? Did it trigger let's go to the home, let's assess the home, let's help remediate the lead within the home? Did that trigger
Yeah, so when we refer to an elevated blood lead level, we're not necessarily referring to a public health response, the 10 micrograms per deciliter. We're referring to the 5 micrograms per deciliter, which public health data suggests would have a long-term negative consequence or could lead to long-term negative consequences. What this entire initiative is focusing on is not how do we find the children and provide them resources after they've been irreparably harmed, but rather how do we go upstream, focus on improving housing conditions at scale so that children are never exposed to lead in the first place. That's really the focus of this. It's primary prevention. We're moving upstream because we know that once a child has been exposed to lead, there are very little data. There's very little evidence about what we can do for children after they've been lead exposed. So we're turning the whole system on its head. Rather than chasing after kids after they've already been exposed, we're preventing that exposure from happening in the first place.
I think that's fine, but something also says to me, you now know a house. You know where that child lives, you know his school district, you know who it is, he's been impacted. He could be one of 5 children in the home, and he could be the one that was, and the others could be safe at the moment.
Yeah,
It-
I'm sorry.
I'm just thinking if it doesn't trigger, it just seems to me that's one you know.
That's exactly right. And that's actually in part why the public health response exists. So that 10 micrograms per deciliter level suggests then that child in that house very likely has lead hazards. There's a lead investigation that happens. The lead investigator will identify where the hazard is, whether it's inside the house or outside the home. It's almost always within the home. If there are other children in the home, for example, that's where you have perhaps seen in recent years the placarding issue in the city of Cleveland. So after a child has been lead exposed at that level, ODH gets their report. That report then goes down to the Cleveland Department of Health. Cleveland Department of Public Health says we have to investigate. They go and investigate. If they identify a lead hazard in the home, put up a placard and say this has to be cleaned up. There's a child at serious risk or multiple children at serious risk. One of the issues in Cleveland, I'll just add for your consideration, is we have such high transience levels in the city of Cleveland that children on average, I believe the number, you'll have to correct me here, move 3 times before they turn the age of 5.
But I'll say this, but you do know the house. They may move, but the
Exactly
house
right.
stays
So that
where
house,
it is.
so the public health response is focused on that house, and until that is ameliorated, it is placarded and residents are not able to live there. What this initiative is focusing on is preventing those placardings from ever happening in the first place. But you're right. For those worst case scenario, 10 micrograms or higher per deciliter of blood, we have a public health response, and that's really through the public health department as opposed to the Lead Safe Cleveland.
This 800,000 focuses on.
Yeah, and let me, if I can, because Dan read my mind, because he knows me so well, and also eloquently said a couple of points, and a little bit better than I did, but also the point of, for children in homes that have been identified through like the elevated blood level and testing process, historically, there has been funding, right, to clear those properties, HUD grants, perhaps, et cetera, but they are very, very specific and only targeted once a child has already been lead poisoned. So that's why this is so important, because we're trying to not have that happen at all. Not have the child be the testing strip to say that there is lead in a property, for us to go in and proactively do such a thing. And just this point about the transient nature of our rental housing, for surely, if a child, you can be lead poisoned at any age. We can be lead poisoned. Our animals can be lead poisoned. I mean, we don't really talk about this much, but anybody can be lead poisoned. So when we think about children are moving from home to home, if they are lead poisoned and that house is identified, that's true, then it's placarded. Then they move out to another property where they can still continue to be lead poisoned, or someone else in the household, et cetera. Our children move so much in our community that it's not fair that they will move from one bad property to another, to another, to another. So we don't want that child to have to be lead poisoned in 3 properties to find those 3 properties. We want to try to cure that problem up front.
Explain placarding to me again.
Placarding. So what? No.
Can of worms.
So essentially, what happens is when a child has been lead poisoned, well, with the elevated blood lead level, and that home or property has been identified, and if the home is not remediated, a placard, essentially, what it is, a piece of paper, is put on that property that says no one can live here. This house should be vacated until the property has the lead remediated from that property. Simple as that.
And do we find that effective? Do we go back and visit and find tenants?
To the chairwoman, that is the responsibility of the City of Cleveland's Department of Health, which quite frankly kicked off this whole thing some years and years and years ago. So I can't speak to the health directors, of the City of Cleveland, but I can say that they, throughout the years, have for surely changed their processes, hired new staff to try to combat this issue. But it's yet another issue with community engagement and the landlords or property owners, et cetera, understanding what has to be done, that there are resources available, and that the property needs to be lead safe.
Question, do we notify landlords in the city of Cleveland that this program is available, since there is now a registry of landlords?
To the chairwoman, If I could say how many ways that we do that. Yes, and that is the one thing that is very important, once again, to stress why we are here today, is this investment, is that the entity EHW that Chantal works for, is that community engagement, sending out flyers. We have a marketing, even within the coalition. The city of Cleveland does its own marketing, sending out the information to the landlords and such and such. That is why it's so important that we have someone on the other end of the phone that are fielding these phone calls to say, I'm a landlord, I'm panicking, I need to know what to do. And the Resource Center walks them through that process. So I believe they are really a trusted source in the community. They've been in all of the wards in the city of Cleveland, knocking on doors, handing out pamphlets. You may have seen driving around the city, there's like if I call it a neon green, it's the Lead Safe Coalition green to me, but there's, green on bus centers, and you'll see ads in people's faces. We wanted to make it really like connectable to the community and such. Even with all of that, there's still more that needs to be done to make sure that people are aware.
So most of us represent districts that have not only the city of Cleveland in them, but inner-ring suburban communities. Is there a plan to reach out to them? Because of our older community, inner-ring suburbs, all have housing stock with 90% of it having been built prior to 1978. So
Well-
how do we begin to spread the programming? Is that on your agenda for example, starting connections with suburban communities next year? How does this happen?
So there are two different questions there. So as far as starting connections with suburban communities, Chairwoman, everyone's open to come to our coalition convenings, meetings, and such. You'd be surprised, or maybe not, how many people have actually reached out to us to say, how did you do this? How does this happen? How did you fundraise? From here locally, from the inner ring suburbs, from other counties within the state, because we do statewide, statewide advocacy. As mentioned, we have statewide funding. This is at the top of a lot of people's plates. We hear from other people, quite frankly, all across the country, because this is what we really also understand, that people are looking for a way to solve their lead crisis wherever they are. And we're hoping that this will be a model that people can somehow take some things from, just as much as we went to Rochester to look at theirs and take back the pieces that could fit here in Cleveland and replicate those, and then plan around those as well. As far as, go ahead. As far as expanding out to the county, and what does that exactly mean?
Sure.
Dan.
All the services available through our Lead Safe Resource Center are already available countywide.
Okay,
So if
excellent.
someone from the county wants to learn how to be an RRP certified worker, then they can come to the Resource Center, and we're happy to train them. We've said since the beginning, and frankly, thank you to your resourcing, we've been able to say, look, if there's another community in Cuyahoga County that wants to pass a proactive rental inspection system and wants to launch their own Lead Safe Home Fund, we would love to partner with them. We would love to expand this model. But we really feel strongly that this has to be both about the resources, both about the carrots, as well as the sticks, that the enforcement is really the apparatus around which we build a long-term sustainable system where, frankly, our private sector resources aren't forever on the hook supporting landlords. We're hoping for a culture change. We're hoping to change the expectation for what it means to be a landlord in the city of Cleveland. And this is an upfront set of resources, an upfront set of grants and loans and wraparound services, but hopefully this will trail off, in the future. If there are other communities that want to join us on that journey, that want to pass proactive rental inspection systems around lead, we would love to help them too.
Dale, did you still have a question?
Yes, thank you, Madam Chair. And just to follow up, I was going kind of in the same direction. Am I correct that so far no suburban communities have passed the certification program, and are you aware of any that are actively considering it?
Through the chairwoman to the councilman, I don't know of any suburban communities that have passed a lead certification law similar to Cleveland's. Is anyone actively doing it? I'm not sure of anyone
I can only
actively.
speak from my personal life. I happen to serve on the board of the Lakewood Community Services Center with Trish Rooney there as executive director, and I know that she personally is interested in improving housing conditions in Lakewood, but I don't know the extent to which she's broached that yet with local lawmakers there.
And the other question I had, Madam Chair, is what determines whether a homeowner that's getting assistance receives a loan or a grant?
One more partner joining us from CHN Housing Partners.
coalition approach.
So essentially, we have two administrators. We have EHW and Buy in Time, but EHW that manages our resource center, and then we have CHN Housing Partners that manages our loan fund and grants.
Hi, everyone. My name is Ashley King. I'm the Assistant Director of Lead Services at CHN Housing Partners. So in regards to your question, we do offer loans and grants. Our grants are income-based, so it's 200% or less of the federal poverty level for the household. And if the landlord themselves is within that income bracket, then they would be eligible for one of our higher level grants.
Refresh our memory, what's 200 in regular dollars for us?
Yes. So I'm actually very happy to say that this number has increased this year. So a household of one, it's about $27,000. And a few years ago, it was a household of one was about $25,000. So it definitely is adjusting. So landlord. And then if the landlord does exceed that income, then we go ahead and we look at the tenant's income. If the tenant's income is within that 200% of FPL, then we would see eligibility for the grant. If neither of those cases apply, then we would go ahead and refer them for our loan product with our lending arm, CHN Housing Capital.
Is there a follow-up, Mr. Miller?
No. Thank you very much, Madam Chair, and I have to go to the Board of Control.
Okay,
Thank you very much.
Ms. Simon?
Thank you. Thanks for your work. I just have a question about the funding, and I apologize if I missed this in the intro from our Department of Development. We are using our budget, $800,000 economic development and health and human service for Cleveland only at this point. Why is, I guess I want to know what Cleveland's doing with regard to funding the fiscal agent, and why we are, that's.
Through the chairwoman to the councilwoman. So as mentioned, the $800,000 that is being provided by Cuyahoga County funds the resource center. And so the services that the resource center has available is available to everyone in the county. So the services the resource center has available, workforce development. So we have training. We have the RRP training, essentially if you want to do any work to remediate your property. We have clearance technician training. That's available to anyone. We have a call center, so anyone can call in and ask questions about, hey, what do I need to do to make my property lead safe, lead free? What is the difference? The very similar conversations we have today are the type of phone calls that are, I guess, solicited, well, not solicited, but received by the resource center. Also, you mentioned the city of Cleveland. So the city of Cleveland has made a $5 million investment a couple of years ago. So that investment was directly to the loan fund. And then additionally, earlier this year, it was announced that $17 million of ARPA funding. So $17 million of the ARPA allocation that the city of Cleveland received is given directly to the Lead Safe Home Fund. And so we are right now in the final stages of essentially negotiating the legislation to make sure what those uses will be.
So will all this, the funding go through Mount Sinai? Or does it depend on, yes, everything will go through Mount Sinai as the gatekeeper, as the fiscal
That's their
agent?
fiscal agent.
Through the chairwoman to the councilwoman, yes. For this award, all of that funding goes through Mount Sinai Foundation as the fiscal agent, and Enterprise Community Partners, essentially, we act as the administrator, so monitoring our administrators to make sure that they are adhering to their contract, meeting their goals and such, and then Mount Sinai is the fiscal agent that pays those invoices and such.
Thank you, ladies and gentlemen, for your attention to what we have to do today. We've been discussing this about 50 minutes. So if there's a major issue.
Yes, I have a follow-up, and I need to leave, so just very, very quickly. What is the highest transmission? Is it the dust? Is it the windowsills? What is it that you find most of our children are impacted by? Just quickly.
It's the lead dust. So you're
Lead
correct.
dust.
Correct.
So when we have the safe, lead dust-free, we are really making a difference, would you say?
Exactly, and that's what everything is built on, that remediation in the home to ensure those lead hazards aren't there. Chipping and peeling deteriorated paint create lead dust. Windowsills create lead dust, and so it is remediating those hazards in the home that is changing the process to make sure they're immediately remediated, and every 2 years it's maintained.
Okay, so lead dust, would you say it eliminates what percentage of the houses that are, I mean, I'll let that go. The second thing I want to say is that because this has been going on for quite a while, and, you know, I've been concerned about this for a while, and I was really glad to see that you're here and you're addressing it, and we have funding, real funding to address it. But we just lived through a pandemic, and we shut everything down in order to get control of it so that we can then resume our normal lives. Unfortunately, it took longer than we anticipated. And I would almost say this is a pandemic of children, that we have these children. If you're talking about 1,000 children affected over 3 years, that's 330 children a year that we know of that are compromised in their health. They're born healthy and they're compromised by their environment. That to me just seems like, what more can we do? You know, in a perfect world, if you had more help, say Public Works, or I don't know, what resources do you need in order to accomplish what we need to do to make sure these kids are safe? And I applaud what you're doing. I understand it. I know you're trying to work within the lines of what bureaucracy allows, but it just seems that the urgency of this isn't as high as I would like to see it. I mean, we're going to come back in a year and talk about this again and make some strides, but I don't think we're going to see the results that we all hope we would see.
Maybe this is something that we have a response from offline. I know
wanted to
most
comment.
of the leadership at these different agencies, and they actually have both my work and cell phone numbers. So what we will do with the Department of Development is try and have a conversation that focuses on what the real needs are and how impactful different levels of funding could be.
Thank you, and I do appreciate your work. It's not that. It's just the
I want to thank the collective body that has come before us, and I know that your labors are significant. Do we need to expedite this legislation since it was from 2/1/22 and we're already almost at 4/1/22? Do we need to move this through the suspension process so that we can take it to the very next council meeting? Okay, thank you. All right. If there are no further questions by my colleagues of an urgent nature, I will accept a motion.
Make a motion to move this resolution to the full council. Did you say on the second reading suspension?
Second.
Thank you. All in favor?
Aye.
Any opposed? This moves forward expedited manner. Thank you all for coming this morning.
Thank you, everyone.
Madam Clerk, do we have another item on our agenda?
Yes, Resolution 2022-0049, a resolution amending resolution numbers 2016-0218, dated December 13th, 2016, as amended by various resolutions, which authorized a grant in the amount of $2,500,000 to the Friends of Historic Variety Theater, Inc., for the benefit of a project located at 11801 through 11825 Lorraine Avenue in the city of Cleveland, by extending the resolution sunset provision from March 16th, 2022 to February 28th, 2023.
Thank you. This morning, I believe we have a member of staff to discuss this with us.
Good morning, Madam. Excuse me. Good morning, Madam Chairwoman, Trevor McAleer, County Council staff. Before you today is a resolution that would extend the sunset provision from March 16th of this year, which is passed, to February 28th of 2023. We also have a proposed substitute that I would appreciate if the committee would consider, which would also change the name of the funding recipient. The proposed substitute would change it from Friends of Variety Theater to Variety Properties LLC. As a reminder to the committee, most of you probably remember this, but we have been discussing this for about 5 years now, since late 2016. This would be the third extension of the sunset. Paul Hertig, Director of Development, is in the audience, and he's been communicating with these individuals, and it is looking promising that something can happen here over the next year. But their department's going to continue to monitor this. As a reminder, in 2020, council did change this from a loan to a grant. So it is 100% grant. 1 million of the 2.5 would come out of the county's community development fund, which is fully funded out of the casino revenue. And then 1.5 of the 2.5 would come out of the county's economic development fund. So the funding sources did not change. Everything, excuse me, changes, everything stays the same except, again, changing the extension of the sunset provision to February 28, 2023, and changing the funding recipient.
Paul Herdig, Department of Development. As Trevor's indicated, this is a council-initiated item. We, however, were asked by Councilman Sweeney to advise on this, and we're actively working on that. We've actually engaged the National Development Council, our representative Corey Leone, who is doing some work on this. Currently, he has a number of information requests out to the developers, so I will not say we're finished with that review, but I will say that it's very close to being feasible. And so we will continue that review and we'll continue to advise Councilman Sweeney as we get all the information.
Now this is the project that's in, was in Dan Brady's district. So as we extend the sunset, the agency, is it the Historic Valley Theater? Is that or is it the CDC of the?
So that was the original name, you know, so it's transitioned a couple times over the last 5 years, Council President. And you are correct, this was initiated by former Council President Dan Brady back in 2016. And that's for the historical purposes, just to see, you can see the legislative history there. This is the fourth piece of legislation in front of you. So the actual award, if this were to go forward, and this committee adopts the proposed substitute, would be to Variety Properties, LLC.
Okay, and obviously Councilman Marty Sweeney is the.
Correct, yes, he is the sponsor of the legislation. Unfortunately, couldn't be here today.
Okay, right.
Asked if I could present.
What is it that we are waiting for them to provide to move forward?
Council President Paul Herdig, without going into the full details, there's a number of questions about the design of the project and the way it's structured that Corey and we as well needed to see. Essentially, the idea is to continue to have both housing and retail as well as the main space of the theater. It's a very large old theater. The main space to be modified so it can be used as an event space as well as for large concerts. And so it's a complicated project. It depends on having income from the apartments, from the storefronts, and also from the event space. And so we and our consultant have asked some very pointed questions about projections for that revenue and how it's going to be structured. We need to get some answers to those questions to give our opinion if it's going to be feasible to go forward. But as I said, we believe it's very close.
Have they given you any insight as to when they may provide those answers, or?
It's actively underway. It is the CDC, formerly, I believe it was formerly Cadell, has a different name now. They have staff working on this. They're working with banks and lenders, so it's a live project. But I think that it is taking a little while to kind of fine tune the design of some things like how they plan to rent out the apartments and what kind of tenants they expect to have in the retail spaces.
Who is the point of contact there?
We work with Anna Kolsar, who's at the nonprofit organization, and there's anticipated to be a private owner to come in to be the principal in the LLC.
Okay, thank you.
Thank you. Would the terms of the loan remain the same, even though this has been extended now for many years?
To the Councilman Paul Herdig, Council has actually converted this to a grant. So
In 2020?
Trevor?
Correct, yes, in 2020,
We just
council
did a
converted.
straight conversion?
Correct, the entire amount of 2.5.
You know, even though we converted that in 2020, a lot's changed since then. And, you know, here we are in 2022, still looking at whether this makes sense. You're reassessing now whether this makes sense? Or are we just waiting to see, I mean, what are we waiting for? You said kind of what we're waiting for to make sure there's, you know, sustenance to the project through apartment revenue but are we going to say no if this doesn't meet some benchmark?
So, Councilwoman, we were asked to advise Councilman Sweeney. So the department is doing this work so it can provide an opinion to Councilman Sweeney.
Wait, pardon me? So you're already doing due diligence for the councilman?
Well, and Councilman Sweeney approached us and said, I would like to continue this project. Can you please assist in evaluating this new plan to see if it's feasible? We are fulfilling that request using the resource of the National Development Council to review what's been presented. This is a council-directed item. We will make our report to Councilman Sweeney. It'll be public and available to all council, but this is at the request of Councilman Sweeney that we're doing this research.
So I talked with Councilman Sweeney, Councilwoman Simon. This was a project that has been 10 years at least.
I
in
was
the
here
making.
in 2000 when this originated, that I understand all that.
And so he is asked, he does not do underwriting or do community and economic development. He asked if the deal is still feasible. And that's the reason for the extension, so that they can work through whether the deal is really still feasible.
Well, it seems, Madam Chair, that there's another component to this, is now the Department of Development is stepping up to do the analysis rather than just simply, you know, dispersing the grant we approved. So we're in a different role, I think, now to see whether the project's feasible through the Department of Development, right? That's what we're doing now, and that's why we're getting an extension.
Madam Chair, if I may add, it's a very similar role that Department of Development has played in this particular Loan Now grant. They've been involved, I would say, since day one at the request of the council president, then Dan Brady, and I think it was just a similar request by Councilman Sweeney just to continue that review to see, because I believe new people are involved than what it was over the last 5 years. I think this is probably now the third potential partner developer on the project. So I think the request was similar to the last two, just review, see if the numbers work, see if this is something that's feasible on behalf of the county before any dollars are actually released to the developer.
I understand. What's the new benchmark? I guess I'm going through the chair to find out what's the benchmark to see whether this is a sustainable project. You mentioned a few items, but on what do you base whether this is a good investment?
Thank you, Councilwoman. So standard underwriting, and we've brought in expert advice from National Development Council, looks at questions such as, are the projected revenue projections and expense projections reasonable based on the information we have about the market and the project itself? And then, you know, we do a mathematical analysis to say, will the project produce enough operating income to carry its debt service? Even though council's directing grant, there has to be debt because this is an expensive project. So we will apply standard underwriting criteria and give our opinion as we would with any project, saying based on these criteria, here's our opinion as to whether the project fits within the standard guidelines for the debt it's going to have to carry.
And who did you say you brought in? Is this somebody we contract with or on every project, or is it just this project specifically that we brought in this particular agency to do the analysis?
Thank you, Council. We actually have an ongoing contract with the National Development Council, which we've had in place for many years. And so when we get these complicated projects, we do routinely ask for their advice.
Okay, that's what I wanted to know. If it's just same contract, same process, same overview.
We're applying standard review.
Okay, so this extension simply to give that space to do the analysis.
Yes, and it extends it through February 28th, 2023, And I forgot to mention to the council, I just wanted to give you projected year-end balance before these dollars would be released of the Community Development Fund is a little shy of $5 million for 2022. So there's adequate resources in the Community Development Fund, so.
Wait, after, you're beyond this, right?
Before it
Before.
releases, correct. It's 4.9 million.
Okay.
If there are no further questions, is there a motion from the body?
Motion that we move this resolution to the full council.
Council, I'm sorry, Chair, we first have to accept the proposed substitute.
Oh, I'm sorry.
Motion.
Would you amend your motion?
I will amend my motion to accept the proposed substitute.
Is there a second?
Overall
I
vote?
second.
Okay.
I did, I seconded. I did.
Sorry.
Overall vote?
Aye.
All in favor?
Aye.
Thank you. Now we vote on whether we move forward to council.
Again, I'll make a motion that we move this resolution to the full council. No need for suspensions. No. Under
Second.
full.
Gallagher seconds. Can we have a vote?
Aye.
Aye.
Any opposed? Hearing none, this moves forward to county council. Thank you. Madam Clerk, is there anything else we need to take a look at?
No other business at this time. We move on to miscellaneous business.
Any miscellaneous business? Hearing none, I believe we are adjourned. Thank you all. Mr. Gallagher, it was nice